I'm Peyton. I'm one of the surgical techs here at ImageLift, and I'm going to be showing you how to place the wrap at home. Alrighty, so this is going to be starting on post-op day 2 for you guys. So that would be the day after you're here in office for your 24-hour visit. You're going to want to take the wrap off, so that's kind of where we're starting in this process. You can do that on post-op day 2 whenever you like, but most people take it off whenever they go to shower. And the cleaning of the incisions are probably easiest after you shower and everything too. You definitely can wash your hair when you're in the shower and use your normal products to try to get out as much of the Vaseline and stuff as you can. So we're kind of going to be starting at after that's done at this point. So I have some supplies behind me. We'll show them on screen. I'm going to be starting off with some HIPAA on gauze to go in and clean the incisions. So the incisions are going to be around your ear, and they're also going to be about an inch long, one under your chin. So the ears on both sides, the one under the chin. So I'm going to start by taking that HIPAA and I'm just dabbing gently along the incision line here to clean off a majority of that Vaseline and any blood that may be there. You're not going to get 100% off when you do this. A lot of it is going to come off in the shower and just as time goes on, but you're just trying to get the bulk of it off if you can. I want to be really gentle when I'm cleaning in this area, and I'm not going to be scrubbing or pulling downward on the incisions, especially near the earlobe, because that's where the most tension is at on the incision, and it'd be really easy to kind of tear it or pull on it too hard. You also want to clean down here under the chin because there is about an inch long incision there as well. And you'd want to repeat this on the other side of the ear also. I want to let that air dry for about 30 to 60 seconds before I go in and do any Vaseline or place the wrap. You want to let the HIPAA air dry so that it doesn't cause any irritation or itching on the skin once the wrap is placed. Now that we've let everything air dry for a little bit, I'm going to go in with some Vaseline. And I'm going to put that all around the incisions and also on the jawline to help prevent chafing when the wrap is on. So again, just nice and gentle. I'm not tugging on any of the incisions, and I'm focusing a majority of my Vaseline where those incisions are. I'm not going to put a lot on Jamie because she was so gracious to be my subject here, my test subject, but I'm going to be placing it on her jawline as well, like I said, so that we don't have any chafing from the wrap. And then again on that incision under the chin there. Keeping the stitches nice and moist and the incisions nice and moist is going to promote healthy wound healing. So that's the purpose of the Vaseline on the incisions as well. I would also repeat this on the other side. After the Vaseline is on, we're going to go in and place some gauze. Now, the gauze at this point isn't to hold really any pressure or anything onto the areas. You're just wanting to have some type of barrier between the Vaseline and the wrap so that the wrap doesn't get all goopy. So I'm going to be placing the gauze right over the Vaseline, and you'll notice that it pretty much sticks to it. So if you were doing this yourself at home, this would be easy for you because the Vaseline holds it in place. I am going to have Jamie hold it on the other side since I didn't put Vaseline over there before I go in with the wrap. So if you notice the placement of the gauze, I have it in front and behind the ears because the incisions do extend back here and then again down here, extending to where the chin incision is. And that gauze being there too is going to help prevent some of that chafing as well. Now I'm going to go in with one of my wraps. This is the white wrap, a gauze wrap. It's called Curl-X. You'll notice that it has really no stretch to it. So this one, when I place it on, I'm not going to be pulling on it because it's not going to be holding any pressure. So I like to start kind of on the side of the head, and I'm going to go underneath the chin incision, and then Jamie's helping me out there, and I'm going to bring it around. And now when I start wrapping, I kind of take the top of the head and I divide it more into a front and a back half because I'm going to alternate front and back each time I make a pass around the head. That's going to help distribute the pressure more evenly where you don't feel like it's bunching up in one place or another. So I'm just going to take this wrap and carry it all the way around until the very end. So that was more of a front pass. Now I'm going to do more of a back pass. And I'm going to make sure that I'm getting it behind the ear and holding all the gauze in. And then that was a back pass. So now I'm doing more of a front pass. When you get to the end of this gauze wrap, you can just tuck it in wherever it ends and it'll sit nicely. Now I'm going to go in with 2 of my Ace wraps. These are the ones that hold the pressure. You can see that they have some elasticity to them. The only thing that I'm gonna do differently when I put this on is you'll notice when I get under the chin, I'm gonna put a twist in it. And all I did to do that is I take my wrist and kind of rotate it 180 degrees. The reason why you wanna put the twist in it is so that it doesn't bunch up under here and, you know, make you feel like you can't breathe or swallow properly. So again, I'm just doing another rotation. And then I did a back pass before, so now I'm doing more of a front pass now. I am slightly pulling on this one when I'm wrapping it so that it does hold some pressure, but I'm not, you know, pulling it out to here. I'm just giving ourselves like maybe an inch or 2 where it's got some of that bounce back to it. The difference with this wrap is that when you get to the end, it does have some Velcro. So you're just gonna stick it, and you wanna make sure that it sits comfortably where it's not gonna be poking any skin. You do want to do 2 of these so that we're holding the appropriate amount of pressure after the surgery. So I did 1, and now I'm going to go on with my second wrap. That was a back pass. Now I'm doing more of a front pass. And most people get about 2.5 or so rotations around the head with these when you're doing it yourself at home. So now you can see all of her gauze is covered pretty well with the wrap, but it's okay if you have to come back at the end and kind of adjust where things are sitting if you don't like exactly where they're at. This side, some of the gauze is back out in the back, so I'm gonna kind of pull this and tuck it in. Is the wrap comfortable where you can breathe? So that's how you know it's placed properly. You're not gonna have any problems talking, breathing, swallowing. It is normal if it does feel a little tight under the chin, and you can take your thumbs and kind of put it in here and pull down if you need to get some deep breaths or swallow something. But otherwise, this is what it should look like. You're gonna be doing this process for 4 days, starting on post-op day 2. And you're gonna be wearing the wrap for day and night during that process. So clean it at least once a day. If you wanna get a gold star, you can do it twice a day. After you're done wearing it like this for the 4 days, you'll switch to just wearing the wrap at night for 1 week. That's it. Thank you very much.